Yo, what up, a-holes? Thank you for tuning into the Holistic A-Hole podcast. My name is Erik Levi, and I am the Holistic A-Hole, the mommy blogger with balls, the inconvenient truth of health. Thank you for tuning into today's podcast where we're going to talk about Medicare and health insurance and this impending crisis that Medicare might just not be able to pay your medical bills, which would cause a little bit of a problem here in the good old United States of America. But before we get into all that, I want to say what's up to all the new A-Hole podcast listeners out there, all the new A-Holes. Thank you for finding the podcast. If this is your first time here, or if you haven't done this already, make sure you hit the subscribe button right there in your podcast player, no matter what you're listening to this on. Apple Podcasts, Stitcher, Spotify, Castbox, whatever it is, make sure you subscribe. That way you get notified every single time this podcast comes out, which is about twice a week nowadays. And make sure you head on over to all the social mediums and find me there. Find me on Facebook, the old Holistic A-Hole page. Just type in Holistic A-Hole. I got new content coming out almost every single day. Just posted the latest vegan Trump supporter video, which is lighting all of Facebook on fire. Make sure you go over to YouTube and subscribe to the Holistic A-Hole YouTube page, which is a great place to find a lot of my videos. And then go to Twitter and Instagram and find me at Holistic A-Hole. All right, so we're going to talk about Medicare today. And man, the old health insurance discussion does get quite heated. I would say one of my most epic, maybe my most epic Facebook post was all about this very issue. It was all about health insurance and how I don't believe in health insurance. And holy good Lord, that was like a 3-day or 4-day long comment thread that just, I mean, hundreds of people just on fire, just so angry about their health insurance. And I'm extremely passionate about this subject, health insurance. And my whole thing is I don't have health insurance. I've worked in the healthcare field. I've dealt directly with health insurance companies, you know, for as much of a monster as people will sometimes refer to the good old Holistic A-Hole. My job was to get people's bills paid by their shitty insurance that they will defend to the end of their lives about how important their health insurance is. Yet their health insurance, your health insurance, believe it or not, does not want to pay your claims. So what you needed was you needed Batman, which was me. I was Batman, to go out there and make it so the insurance companies know they got to pay your goddamn bills. They don't want to, but somebody's got to make them do it. And so essentially what's happening is Medicare, which is the granddaddy of them all, the godfather of health insurance, the godfather of state-sponsored political and financial corruption, is projected to fall short of its obligations, payment obligations, by the year 2026, which is actually 3 years prior to when they originally made their projection that Medicare would reach a shortfall. Now, it's being put out there that Medicare is going to become insolvent and they're going to run out of money, which isn't true. That's not how this works. This is a la Dean Baker of man, I don't know his website, but just Google him. He's a financial blogger, kind of knows his stuff. But he makes the case that, look, Medicare is not going to be insolvent. It's just going to fall short. They're only going to be able to cover 90% of the payments due come 2026. And you have to imagine, though, that that's going to be a steady decline from that point forward. And maybe by the 3 years that they are going to hit this shortfall too soon, 3 years later, maybe they do become insolvent, or maybe drastically decrease the amount they're going to be able to cover payments. Because here's the fact. more and more people are getting old than ever before. More and more people are becoming very, very sick earlier than they would have when they were had they gotten older and got these diseases, and people aren't making as much money to put into Medicare. Our GDP just isn't growing as fast as Medicare. Medicare payments are growing. So this creates a bit of a problem. Now, I support the idea of Medicare. When you reach this age of 65, you get basically, I don't want to say free health insurance, because I believe there is still a bit of a little bit of a premium, I think, and it's not all 100% covered. It's like Medicare a lot of times will cover 70 or 80 or 90%, and you still got to find like a co-insurance. This is where something like AARP comes in, or Blue Cross, or one of these HMOs. But the idea is, look, Medicare is this government-funded program. It's a government-sponsored program. The taxpayers are the ones who fund it, and so when you get older and you're not able to work, or you retire, and you don't have money coming in to pay for your health insurance or your health care, Medicare is going to be there to cover it. It's what do they call it? Not a benefit, entitlement. Oh boy, that word, entitlement. We are Americans, and we are entitled to the government just taking care of us. That's how that's how this all came about. And in theory, it's a great idea. In practice, it's fucking awful. The government really has no business trying to do healthcare. It really should be left to private insurance. Everybody wants single payer, because I don't think anybody really understands what single payer means. I think people hear the word single payer and they just say, oh, the government's just going to pay for all our health insurance. So guess what I can do now? I can just go to the doctor as much as I want and just get all the coverage I need, because I don't have to pay nothing, because the government's just going to pay for all of it, which really just couldn't be further from the truth, man. Because the government, let me tell you how this works. When you go to the doctor and the doctor performs some service, and as you get older, those services get more and more and more complicated and more frequent. You start dealing with crazy stuff like cataracts and, broken hips and, fucking all this crazy shit, right? And then your doctor's office will send the claim to Medicare. And let me tell you something, man. I always thought it was kind of tiresome how people, compare like government services always to the example of like the post office or the DMV. But after working in healthcare for 7-8 years, it's worse than that, dude. Your paperwork just goes right there, and there's just a bunch of people getting paid $11-12 an hour, in some podunk town, maybe in Ohio or Texas, somewhere, and they don't give a shit about this job. They're just punching the clock, taking 2 15-minute breaks and a 30-minute lunch, and they're getting the fuck out. They don't know who you are. You're just a number on a page, and they, put it through a computer, and it either gives the qualifying information or it doesn't have the qualifying information. And if it doesn't have the qualifying information, which could be something as benign as a misspelled fucking address, or an error on the birth date, or an error, this is what happens a lot, an error on the procedure code. Medicare will cover, let's say, ICD-9 code, M266, right? Which, let's just say, for instance, is like a broken fibula. But it will not cover Medicare line item 265, which is, a different kind of broken fibula. And so just because, your doctor's office's administrative assistant didn't write the right code or missed it by a digit or something, they deny it and they send it back. Or if it's all right, they approve it and they pay it. It could be no less example of care anywhere else than in Medicare. Medicare doesn't care about you. Medicare is about taking the money that you earn at your job, putting it into a giant fund, and then distributing it out while the people in charge of all this are the ones getting paid by the insurance companies, by lobbyists, and probably even out of the the taxes that you pay to make all this shit possible. So is it really any surprise then that Medicare is gonna fall short because it's such a poorly executed system? Not to mention, man, people are getting sicker and sicker and sicker. There's fucking kids who have type 2 diabetes. Okay, this used to be called adult onset diabetes. Okay, now you have kids that are 11, 12, 13, 14, 15, 16 years old getting type 2 adult onset diabetes, right? This is a 100% preventable disease. You should not be getting diabetes before you shouldn't. Well, first of all, you shouldn't be getting diabetes at all. Granted, type 1 diabetes, that's something totally different. But even that is, arguably preventable. But type 2 diabetes, man, is completely preventable and is completely curable. Yet what happens? 11, 12-year-olds are eating way too much junk food, processed food, high fructose corn syrup, grain-fed, processed fast food, meat, just putting all the wrong shit in their mouths, soda, candy. Now, look, I'm not anti 100% soda and candy. I get it. When you're a kid, yes, you're gonna, goddamn, I can't even believe I'm still alive with all the stuff I ate as a kid. And I'll make the argument that I wish somebody had this knowledge that I'm dishing out to you guys to let me know that, dude, if you want to live past, 40 without dropping thousands of dollars every month on medication, you should probably fix your diet up. I can't even believe I'm still alive to tell you guys this story with all this the terrible garbage. I'm pretty sure I was pre-diabetic when I was a teenager, man. I had instances where I would go out and just play basketball in my front driveway and then just get dizzy and have just an insane blood sugar drop because all the shit I was eating was just off the charts, of the blood sugar insulin scale. Oh, goddamn, what is that? You know what I'm talking about. The insulin response scale. Why can't I think of it? Either way, you know what I'm talking about. But yeah, this is what's happening. People's diets are worse and worse and worse. We're more and more lied to by these quote-unquote health professionals, by the FDA. The FDA is run by people from Monsanto and the pharmaceutical company. So is the USDA. So are all the people that are making sure that the food and nutrition in our daily lives is not completely tainted with chemicals and high sugar and terrible parts that essentially damage your body's homeostasis. Not to mention all of the chemicals that are in our water, in our air, in the materials that we use every single day, all of the plastic, all the BPA, all the, endocrine disruptors, fucking up all of our hormones. I mean, people are depressed, they're anxious, the calcium's being stripped out of their bones, they're becoming more brittle. I mean, dude, it's just amazing just how bad our health is right now. And so is it any surprise that in 8 years, Medicare is just not going to be able to cover all the payments that it needs to make? Because let's face it, we're just too sick for this system. Not to mention, you've got everyone talks about the baby boomers hitting retirement. Well, in 10 years, who's going to hit retirement? 10, 15 years, early generation Xers, people who, grew up in the 70s and 80s and then 90s are going to start hitting retirement. These people are sicker than ever. Look at my generation, the Generation Y, the millennials. I mean, dude, We are so sick. And then look at the fucking kids now. What is it? The generation Z or whatever they're called. I mean, these robotic kids who are being put on, SSRIs and antidepressants and, diabetes medication before they're even 10 years old. I mean, you have obesity at record amounts. The system is just not built. It's not built for this. It was built for, people in the 60s and 70s who granted the 40s and 50s, who granted weren't healthier than us, but also didn't have the life expectancy. For as sick as we are, we're also living longer. A lot of us are living longer because we're getting all of this medication. That's not making us any healthier. It's just prolonging the painful lives that people are living through. Let me tell you something, man. Somebody who's sitting there on oxygen, most of those people are not happy with the way things are going in their life. Although, granted, they are, they have Medicare, spending $500, $600, $700 a month on their oxygen. Many of them don't even use. Many of them will sit there with the oxygen in their nose and smoke cigarettes with the oxygen in their nose, despite the fact that shit is the most blatant fire hazard you could possibly imagine. This was my job, by the way, when I worked in healthcare, years ago. I would go to people's houses and deliver oxygen. I would be the guy who ran the test to see if they were on oxygen. And let me tell you something, man. I smelled a lot of cigarette smoke in these houses where there was oxygen sitting, and then at the same time, there'd be kids running around. Let's stop giving people the benefit of the doubt, by the way, that if they receive health insurance, that they're in desperate need of government care, okay? A lot of people are, but then a lot of people are just riding the system. And a lot of people are just taking whatever their doctor tells them because the doctor needs to get paid, because he has to stay compliant with the health insurance. And, they just, in turn, give all these people all this stuff that isn't making them better, all right? Case in point, man. Case in point, you would think that maybe in theory, if healthcare actually worked, if health insurance actually worked, if Medicare actually worked, that it should be getting people healthier, when in fact, nothing can be further from the goddamn truth. We spend on healthcare per year. In 2016, we spent $3.3 trillion. That's with a T, as in Tom. Trillion dollars. $3.3 trillion in overall healthcare spending, which accounted for 17.9% of GDP. Okay, almost 18% of GDP is spent just giving people medical services. Okay, by the way, that comes down to $10,348 per person in the United States, which that also includes like babies and kids. Could you imagine if we were able to give that money instead of giving it to healthcare, if we were just able to save that as a country, all of these roads and bridges and, all these things that you want government to build for you. I mean, we could have a high-speed freaking rail that goes between LA and New York in like just a couple hours. I mean, this technology exists, but we can't afford it because we're too busy, plopping people as soon as they turn 65 on fucking oxygen, or getting them all of their, antidepressant medication or anti-anxiety medication, or blood thinners, or, blood sugar medication, or, holy shit, Prilosec and Zantac. We talked about this stuff in the last episode, treating their heartburn and GERD. Not to mention all the people who are suffering from, stomach ailments, Crohn's disease, ulcerative colitis, fucking diverticulitis. I mean, dude, if you just took... Now, look, I'm not trying... Let me put this as a disclaimer. I'm not coming out against people who use health insurance for like emergency situations, or you need your health insurance like if you got cancer, right? I mean, look, I can go off about this too, but I'm just gonna say, if you have some kind of emergency, right? You get hospitalized, you have a stroke, you have a heart attack, again, cancer, whatever it is. I'm not talking about those people, although a lot of that stuff, dude, is all lifestyle. And if you fixed your lifestyle, you wouldn't also need that stuff, you know? I'm not talking about babies who are born premature and are in incubators. I'm not talking about babies who are born, deformed or with some emergency malady or anything like that. I'm not talking about young children who have leukemia. I'm not talking about that, okay? Obviously, that's a huge problem. And in a lot of respects, I hate making people the guilty party or making people feel guilty or, victimizing anybody. But a lot of times, a lot of these childhood diseases, these, it's prenatal issues. A lot of this stuff is prenatal, I know you're not allowed to talk about it, but I'm the holistic a-hole, and I'll just put it on there on the table, A lot of babies are born with a lot of these illnesses and diseases because of prenatal care, because of prenatal care, because, the mom or the dad or whoever didn't really take care of themselves, so they passed on a lot of really bad genes to a poor baby who now has to suffer with it, okay? But let's just take all of that out of the equation and just leave in all of this stuff that can be controlled. Diverticulitis doesn't just show up. Crohn's disease doesn't just show up. Type 2 diabetes doesn't just show up. Even Alzheimer's doesn't just show up. It's built by the person who isn't taking care of themselves the way they're supposed to take care of themselves. A lot of this shit does come down to adequate nutrition. It comes down to diet. It comes down to lifestyle. It comes down to avoiding alcohol or avoiding hard drugs or stress. Everybody's keeping up with the Joneses. Everybody has to, work some job they hate so they can buy a house that's too big and drive to it in a car that costs way too much. And then, so they can also keep up on Facebook and post pictures of them living their greatest lives. So they go into debt to do all this stuff, to go to these places so they can get a stupid Instagram picture, while at the same time completely avoiding all of the actual shit you should be doing to keep yourself healthy. This isn't the stuff that's preached, by the way, in mainstream news and information. Everything's about, hey man, how do you lose weight? How do you get a six-pack? How do I get veins in my arms? How do I make my boobs bigger? How do I make my lips plumpier? As a guy, how do I get my calves to look bigger? It's all just ass backwards. So is it any surprise then that people are getting sicker? People are getting sicker, and we're spending all this Medicare money on diseases and ailments that, quite frankly, and Medicaid money as well, that quite frankly isn't making us healthier. If you spend $3.3 trillion in your country, or over $10,000 per person, if you were to take just adults, that number would probably go up 50%, $15,000 to $20,000 per adult in the country who's actually at work making money. These people aren't healthier. They're not healthier. Healthcare is not healthy. Healthcare is sick care. Healthcare is meant to keep you sick so you can keep going to the doctor, so everybody can keep making more money. That's all it is. And the only way to stop the vicious cycle is to learn how to take care of yourself with nutrition properly. Nutrition and lifestyle. Granted, yeah, man, you might have something in your genes that, you can't control through diet, There might be, a molecule, or there might be something in the paint, in the walls. You might live too close to a gas station. You might live by power lines that are giving off, radioactive EMR radiation, right? You might live in a place that has just filthy, polluted drinking water, and you're just chlorinating yourself and fluoriding yourself to death. There's an infinite amount of possibilities. But the most controllable thing that you can do to keep your healthcare costs as low as possible is, without a doubt, nutrition and lifestyle. And if you are not taking in the correct nutrition and lifestyle, then yeah, man, you're part of the problem. If you're buying pharmaceuticals to keep your blood pressure down, you're part of the problem. If you're buying pharmaceuticals to alleviate your heartburn, you're part of the problem, dude. If you are, if you contracted type 2 diabetes because, you're just eating garbage food and you refuse to change, you're part of the problem, okay? The government, no matter what we do, they could do single payer. We don't make enough money in this country to have a single payer system. If somebody's going to go into the doctor, once every week because they have diabetes, what about the baby who does have leukemia? You're literally robbing funds from that baby with leukemia. There's only so much money to go around. What about the fact that that inflation exists, that the amount of money that we make in our paychecks is actually less and less and less, every single year because of inflation? What are we going to do when federal interest rates start going up or keep going up, thus making the money supply or the money that you have less and less and less actually, actually feasible? What's going to happen? It's all monetary policy, and relying on Medicare to just magically take care of all of it for us, we're just not thinking correctly. We're just not all on the same page. I mean, it's frightening. It's frightening to think that when you're 66, 67 and you do need your Medicare payments, let's say you are, too old to get back in the workforce, or, you let's face it, a lot of baby boomers just aren't going to be able to learn the modern economy. If you worked in a factory for 20, 30 years in the middle of Ohio, you are not going to get hired by a startup who developed an app that's going to deliver food at 2 o'clock in the morning. You're not going to become a programmer. You're not going to be a coder. You're not going to be able to make the money that you were able to make, and you're not going to be able to be a part of the economy unless you want to be a Walmart greeter or whatever. Not that there's anything wrong with being a Walmart greeter. So you're not going to be making the money you need. So you need that Medicare to kick in. Because let's face it, dude. I could have all the wishful thinking in the world, but I know people aren't going to change their behavior, Not when another milk commercial comes on the television telling you how great milk is for your body, and you go out and you keep drinking milk, not fully understanding that the milk is so acidic and has so many harmful chemicals in it and antibiotics in it that it's actually it's literally stripping enamel off of your bones. It's literally stripping away your bones. And not helping you at all. It's actually making you weaker as a person. But people are like, I got to go drink my milk because it's good. Let's also keep in mind that they do keep that Medicaid is also going to be hitting shortfalls. So what about all these people who qualify for Medicaid? A lot of people who qualify for Medicaid are also on food stamps. And let me tell you something, man. Food stamps are not paying for kale and broccoli and, healthy whole food. Or at least the people who are, using food stamps aren't being taught about the healthy ways to eat. You can go buy all the white bread and white sugar and processed garbage and candy you want on food stamps, okay? And what does that lead to? It leads to more need for Medicaid. And so what are these people going to do, There could be no better example of what I'm telling you than the example of Medicaid. How the government is literally giving you more of the bad shit to eat and then not covering you when you need the health care you're going to need from polluting your body with all of this toxic stuff, This isn't just me talking shit. This is real. This is real, actual science. If you put bad, toxic stuff in your body, if you don't nourish your body with vitamins, minerals, and nutrients, with the right fatty acids and the right amino acids and the right glucose, if you turn overweight, if you start getting the gout, if you start dealing with diabetes and heart issues and adrenal fatigue and all this stuff, if you don't have the money to pay for the care, what are you going to do? So I guess the whole point of this is Am I surprised that Medicare is going to fall short? No, man. I wouldn't be surprised if they come out with another projection next year and say, look, 2026, that was being a little lofty. We're going to start falling short come 2024 or 2023 because, man, people are just getting sicker and sicker faster than we could have ever thought. But yet, what are we never going to do? We're never going to go to the food supply. We're never going to fucking look and examine the food supply. We're never going to look at the fact that all of the food that we're selling in grocery stores is all toxic. That if you go to a meat section in a Publix or a Fred Meyer or a Safeway or whatever grocery store is near you, Key Foods, whatever it is, if you go to the meat section of these places, you'd be very hard-pressed to find grass-fed meat. And if you do, it's fucking ridiculously expensive. So completely unreasonably expensive. But if you want some grain-fed fucking rump roast, that costs like $3, right? You might be like, dude, I'm getting meat, I'm getting protein, but you're also getting all the antibiotics. You're getting also all of the pesticides. And that's the other thing, they keep just pesticizing our food, into oblivion. It's like fucking, all of these pesticides, the DDT, the fucking, the glyphosate. How many studies do you need to see that show that all of this is carcinogenic? Monsanto is sitting here fucking hiding all of these studies so nobody can bring them up and say, look, man, all of the food that you keep selling, Monsanto, and growing, all of your seeds, it all leads to cancer. But yet we still keep buying it, dude. The government will not look at the food supply because the food supply runs the government. When healthcare accounts for 18% of GDP, dude, that's a fucking pillar right there. That's a foundational pillar of our GDP. So we need people to be sick. We need the food supply to be tainted. We need the water to be polluted. We need the air to be fucking as toxic as possible so people keep getting sick because, dude, the American economy is built on not keeping people healthy. It's built on treating people who are sick until they get better, until they get sick again. So let's not be shocked when Medicare is going to fall short like it's going to. I am interested to know what you think about this. I could rant and rant and rant, but I do got to keep this podcast within a reasonable time limit. But I do want to know what you think. If you have a strong opinion about health insurance and Medicare, about any of this stuff I just talked about, shoot me a tweet on the old Twitter, shoot me a message on Facebook. You could even take a picture, a screenshot of the podcast playing in your phone or device, and then post that on your Instagram and tag me at Holistic A-Hole, and let me know your thoughts. If you think I'm right, if you think I'm off base, if you want to add to the conversation. I know there's so many more angles that I can hit this on, and I probably will in future podcasts, but if you have a personal story about like a Medicare horror story or a Medicare, hero story, I would actually like to know because this is shit that I'm actually interested in. And, if you want me to, I'd be happy to share your story on a future podcast. So let me know, okay? If you did enjoy this podcast, please go on over to iTunes, leave me a 5-star review, put a little note in there of what you liked about the podcast, and share this with anybody who you think might enjoy it. And if you're new here, make sure you go back and catch up on previous episodes, and then I will catch you on the next Holistic A-Hole podcast. Thank you all for listening. Have a great day. Peace.